Thank you. Thank you so much. And I am really delighted to be with everyone today. I want to start by showing you the Deshkan, or as some of us know it, the Thames River that flows through Western and is also flows through London. And it's a really beautiful river that I visit often. It's very dynamic. When it's raining, it's big and powerful and floods the hiking paths I sometimes take. And then when it's drier out, it really contracts. But whatever it's doing, it's feeding my soul. The woods around the Deshkanzibi feed my soul. And I think that's really important because today we're talking about student mental health. We're talking about reconnecting people to the land. We're talking about the changes in the environment that are causing a lot of students eco distress. And there have been people for centuries who've been excellent shepherds of this land and excellent caretakers. And I think it's really incumbent upon all of us to take care of this land, not only for the land's sake, but for our own mental health and our students' mental health. So I want to acknowledge that where I'm sitting at Western University today, it's located on the traditional territories of the Anishinaabe, Haudenosaunee, Lenape, and Chandlee nations, on lands connected with the London Township and the Sombra Treaties of 1796 and the Dish with One Spoon Covenant wampum. Part of truth and reconciliation means to learn, for us allies, to really learn about what this means. And so there was a call for us to read Megan's call to action, and I will commit today to doing that. And maybe you can reflect on whether you would like to make similar commitments. I would also like to acknowledge that a close colleague of mine, Mel, I saw is on this call today, and really want to honor what she has taught me in the last few months about truth and reconciliation and commitment and how to be a better ally. So thank you, Mel. Okay, so we're all here because we have this job to do. We have to create a mental health strategy, policy, whatever. But if you're willing, um, take out your little cell phone and click on the QR code and let us know where you are in this process. Let's see if this can work. I got a lot of help yesterday to try to get it to work, so it would be great if we can make it work. Are you just starting in the process, partway through, have a rough draft? Ooh, it's working. Awaiting approval, or you're just really zooming in on implementation. Wow, a lot of expertise here. Great. So given that there's a lot of expertise, some people are already at implementation, I'm really hoping that this is a discussion. So if you're comfortable turning on your cameras, I would be grateful. I like seeing faces when I'm talking. It's less lonely. And if we work on this together and do this in a shared way, we're all going to learn a lot more. I'm going to learn from you. And I think we can help build a community of people trying to best serve our students. So I'm hoping that within the next half hour or so, We all have a shared understanding of what's required by Bill 166. We all have a plan on how we're going to get going on this work or how to advance our work in towards meeting the requirements, and hopefully also feel more confident that we're on track. And hopefully, ideally, maybe even experience a little joy along the way. Okay, so let's get into the meat of it. There are some key elements, and the key element, the very key element, is that we all have to make a commitment to student-centered principles to demonstrate that we care about their mental health. That's what this is all about. And part of that is providing easy access to information about our programs, our policies, our services, our supports on campus and in the community. Anyone involved in healthcare cares about their privacy, so we have to demonstrate that we're providing a confidential service and that a whole range of services are provided, from wellness promotion to crisis response. But then there's also opportunities for us to think more deeply and reflect more deeply on what we're doing. It gives us an opportunity to review the current state, to find where we're strong and where we have gaps, and to consult with the students. They are the end user. They're our why. And so bringing them in the process, listening to them is really key. And it was described, and as we'll hear more from Benjamin this afternoon, it's really critical that we offer equitable access and culturally safe supports. Students who may come from a more marginalized background, who have problems with accessibility, are not going to come if they do not feel welcome and safe. And creating a really healthy campus environment is a campus-wide effort. And so we have to work to embed our work throughout the institution where the students are, not just, I sit in Thames Hall, that's the name of the building I'm in. And if we just are Thames Hall focused, we're going to miss a lot of students. And so we have to cultivate partnerships and support services beyond what our school can offer. And so we ended up thinking that there are two parts, two ways of addressing this bill: the manual or our policy that we put up on our website, and a more reflective practice to create a strategy. Now, we didn't intentionally start out that way, but that's how it sort of settled out, sort of breaking out the work into two separate processes. It worked for us, maybe you all did it differently, but creating two processes was so helpful for us. So we're going to talk first about our policy or manual. Okay, it's a PDF on our website, and we students don't read PDF, but our dream is that one day we'll have AI that will help direct students to read the PDF. But it is a one place where all of our information exists. And this is basically the table of contents. And I provided it so you can see what we thought it would be valuable to include. First was a definition of what are we talking about here? What is mental health? And sort of describe that it doesn't mean that every day is rosy, but that some days are challenging and some situations are challenging, but it's the ability to work through that and keep going that sort of describes a healthy existence. And that it's a shared responsibility with the student, our culture, our community, and the institution. It's not that one group has all the responsibility. And then we get into operations, what we do, our roles, our model of care, the kind of appointments we provide, what to expect at the first visit. Many of our students have not seen a counselor before. They've not seen psychiatry or family medicine before. They, what to expect. And what we don't do. We are not a 24-hour crisis intervention service, and we are explicit about that. How to connect with us, how to find a therapist, how to book online, when are we open, nuts and bolts, how to reach us. What happens if you are late or miss an appointment? What if you need some help with academic relief or want a copy of your records? Or let's say your interaction with your therapist doesn't fit. How do you change therapists? And what are the limits to confidentiality? And we are not using AI yet, but we still describe, hopefully we will, because I hate dictating and spending all my time on notes. I hope we have AI in the future, but how we will safeguard people's privacy when that happens. Services beyond the main clinic, such as embedded counseling, and our accountability to the board, to the Ministry of Training, Colleges and Universities, and what are some of our community resources. Now, I'm sure as some of you are looking at this, you're thinking, wow, they forgot this, or why didn't they have that? So if anyone sees something they think is missing in this manual, this sort of operations and philosophy book, could you please share it? Again, if the more we share it together, the more interactive this is, the more we will all learn. So did someone include something on their website that you don't see here? We also on our website describe groups. But is there anything else that you would have included? You can raise your hand or just speak out if you see something missing. All right. For example, when we talk about shared responsibility, when I first typed this out, I just said, oh, we have step care. And I gave the manual to a student for feedback, and they're like, what's step care? And so then we spelled it out. What are the steps students can take initially to try to safeguard their mental health, and all the way up the continuum to when they may need admission? So getting that feedback from students was critical in making things clearer.
Oh,
So,
Chandlee, I just want to add a comment from the chat.
oh, no,
Um,
oh,
yeah, Kathy described we describe our health promotion services and workshops, counseling, and medical services as well. That's McMaster.
thank you. For some reason, I'm not seeing the chat, maybe because I'm sharing. So I really appreciate your helping me with that, Julie. Anyone else? Okay. So tips on writing the manual. Number one is get students to review. The other thing that I wrote that students gave us feedback on was that I described our confidentiality and it didn't make sense to them. So that was really helpful feedback for me to make that clearer. We also had our counselors review it, and that was invaluable because they shifted the tone. I'm an MD, so I'm just going nuts, bolts, nuts, bolts, nuts, bolts. And then they put in the tone, the flavor, the welcome, the invitation. That was so helpful. So please involve all of your counselors because more eyes on it, the better. And then the legal review. Because this act requires student involvement, and we had it, but they highlighted to me that it may be important to keep notes of how the students were involved in case that's needed down the road. So the more eyes you have on your work, the better your product. But what else? What do students need to fly and thrive? What are the processes or strategy? How are we going to make things better? So we're going to shift gear from operations and just sort of like dry manual writing to creating a mental health strategy. And many of you are far along, you're already on implementation. So please add your comments as we talk about creating a mental health strategy. And again, focus on the students. What does this person need to thrive? And I think one of the most important things is to be really clear on the task before you start. Secure resources. It's going to take some resources to do this. Form a team or two, gather input, write the draft, get more and more input. And we're going to sort of go through some of these steps. And I'll tell you when I may have missed a step so that you won't. First, be clear on the task. What do you want to achieve? What does your institution want you to achieve? How does they want it to look? What's the end product? And what will it take to be successful? Spend the time getting clear. And then secure resources. So we were really fortunate that Deb Kyoto, the person who wrote our 2018 mental health strategy, was still in town, and we hired her as a consultant. And that was phenomenally helpful for me because I had never led a focus group before. I'd done lots of things, but not that. And so I was able to observe her first. And there are all sorts of ways that a consultant may be able to help you in through tricky parts, things that you may not know as well. I also took a course in strategic planning offered at Western. It was just one of these 3-hour things, but it helped me understand the steps and it boosted my confidence. Okay, the big resource you need is administrative support. There will be a lot of meetings to schedule, a lot of emails, a lot of room scheduling, cookies to order. You need help. And today at 1, Jennifer is going to talk about surveys and data. And you may be a survey wizard, but you may not be. So you may need some help with data collection and analysis, how to write survey questions, how to, what kind of incentives you need, how to collect data, how to analyze it, how to integrate it into your final product. And then you need cookie money. I mean, we're meeting virtually, which is needed given, reality. But ideally, we'd all be in person. And ideally, we'd be all having coffee and cookies together because it really helps engagement. And so be sure you get some cookie money to help facilitate discussions. Any other resources people found important to have that aren't listed here? Anything missing?
Dr. Dickey, we have a question here asking, do you have a link to the course on strategic planning? And is this something that can be shared?
Uh, I don't know. That's an excellent question. It is an internal Western course. Um, can I get back to you and let you know later, Taryn?
100%. And folks, just a reminder that we will be sharing a lot of our notes and post-presentation material in the coming week. So no worries if you don't have all of it today. We will get it to you soon.
It's a team sport. And then form a team or two. Do not do this work alone. The product will not be as good. So we had, well, ultimately two teams, a core team of 6 people. We did all the work. We met weekly, we created the surveys, we led the focus groups, we wrote the draft, but then we had this incredible action and advisory team, about 41 people with student leaders and broad representation across our campus. We met 4 times for 2 hours each with structured meetings to ensure that we were good stewards of their time. And they also, in the background, reviewed our surveys, looked at our data, read our drafts. But the most important thing that action advisory teams did was provided frank feedback. What they're seeing on campus, what the students think, what is really key. And so creating an atmosphere in which people can be open to share is invaluable. The most important thing is to get input. So we had 3 surveys, a student survey, a staff and faculty survey, and then we had a targeted survey about cell phone use because we were curious about that. We saw it as an emerging issue. But think about, what do you need to know and from whom? And then in your questions, and I am not a survey expert, and I think Jennifer will have way more important things to say later about this, but are your questions neutral or leading? For example, you can ask, we have all, the counselors at Thames Hall are awesome. Rate that on a 5-point scale. Or you could ask, the counselors at Thames Hall are lousy. And you're going to get very different answers depending on whether, because of that bias, the bias that's behind that question. So there are some questions that you may want to be leading or biased, but others you want to be neutral, and be intentional about that. And if you're going to ask a question, think ahead. How will I use that information that I get back? And if that information isn't actionable, maybe not ask it. Do you have a good mix of quantitative and qualitative questions, and yet have the survey short and sweet? Pilot them first. I could write a question, think it's so obvious what I'm asking about, and then someone can take it and have a completely different idea of what I'm asking. So it's really, really good to have a few people pilot the questions first. And then, is there anyone in your institution who should review the questions first? For example, our survey, our strategic plan is only addressing student mental health. There was a lot of discussion in our institution that it should be more comprehensive, should think about staff well-being, as Megan's efforts point to, but that was not our task. That was not our mandate. And so when we had the faculty and staff survey, you'll see in a couple of slides that we were very careful of how we worded it, and we had to have HR approval for that. So figure out who may need to look at your questions. Focus groups, really great opportunity to get people's perspective. Think about which groups you need to hear from, how many you can manage, and how you can engage students. Who are the influencers who might get students to come? What do you need to ask? What do you really need to learn from them? And importantly, again, how are you going to create that open and welcoming environment so people actually tell you what they think and give you feedback? So these are some examples of what we asked in focus groups. What are the key issues facing students? What are we doing well in terms of creating a healthy culture? And what do we need to do differently to promote a healthy culture? What do people think of substance use on campus? What about cell phone use and how it relates to mental health? Where are our gaps in programs and in supports? And are there student groups who need specialized supports? Benjamin's going to be talking about that later today. But we know that more marginalized, racialized communities and students have worse mental health. So what do we need to do to help them? What are the institutional supports and processes that we need to shift to support a whole campus? And what are the must-haves in our strategy? And what are some immediate actions we can take now that we can get running right away and don't have to wait the whole year or however long this process is going to take us? But these are kinds of some of the things we've asked in focus group. But what about you all? What have you asked in your focus groups? Or what do you think you would like to ask, even if you haven't gotten there yet? The more we share, the more we'll all learn. I'm sure I'll learn from you. Are you asking about eco distress? Um, are you asking more EDID related questions, specific questions?
In the chat, we have folks answering. Someone said we asked about how they define wellness as well as how, sorry, as well as have them help prioritize what were the top 3 things we needed to address as part of our strategy. Someone also mentioned food and housing insecurity.
Yeah, finances in our student survey was a very prominent theme, that our students are struggling with basic food security and housing. So it's really important. It's really hard to write a great exam on an empty belly. So I really appreciate that. We've asked those as well, but they're very important. Thank you. Any others? Okay. So I also share the staff and faculty survey because it was tricky to write. So we had, again, a balance of quantitative and qualitative questions, open, free answer comment sections. But on the quantitative, I'm familiar with mental health services. I've referred students. I feel confident supporting students because not all people do. It can be overwhelming when asked to support a student's mental health needs. That's a leading question, but we really wanted to ask it in that way. The mental wellness of university employees can be significantly impacted by students' mental health, and the mental wellness of university employees can impact their ability to support students. This gets to this idea that we're a community, and the health of one of us impacts those around us, and to try to understand that interconnection. Even though we are focused, our task is student mental health. This is a way for us to understand that interconnection and reciprocity. And then qualitative questions like what support, education, or messaging do you need about mental health or substance abuse? And what innovative ways are you or your colleagues already supporting students' mental health? Because there's a lot of incredibly good things happening on campus that we don't know about. And if there's this gem over here, we want to propagate it over here. So it was really beautiful to read all the things that are happening. But what else have you put in your faculty and staff surveys that you don't see listed here? What ideas have you had that were really helpful for you? And pop them in the chat, that would be great. I have no idea if people are typing. This is one of the problems with Zoom, isn't it? It's hard to know when to keep talking and when to wait. Maybe we'll go on. But the bottom line, for me at least, is that the more people are involved in the process, the more we'll be committed to its success. That we really want high level engagement. You know, a majority of you all said that you're already on implementation. And to implement a mental health strategy takes a lot of people. It's significant work. And so getting people involved in writing the strategy and thinking about the strategy and the policy can help them have some ownership in its end result and the outcomes.
We have one comment from your previous question. Someone said, we tried to investigate 3 items: student mental health, employee mental health, and what employees need to support student mental health.
Yeah, I don't know who wrote that or what institution you're from, but you're kind of lucky that you get to do it together. Because I do believe that, that this is community work. This is collective work. And the ability to sort of do it in a holistic way is a real advantage. It's more work, it's harder, but I think you can have a better outcome. And then write your draft. And we wrote one, and it was all organized, and we submitted it, and it got booted back. Had to reformat the whole thing. And so my words of advice to you are don't get, emotionally attached to your words. It's a campus plan, not your plan. And the more you can be open to rewriting and rewriting and rewriting and reworking it, the better, because it will take multiple drafts to get something that your institution will really get excited by and revved by. So you've got your draft. I don't know if there are more comments to reread, Taryn.
We just have Karen, who shared initially that they're from Niagara College.
Oh, well, welcome. Thanks. Okay, you've got your draft. Now you have to put it all together. Hopefully you have a communications person who can make it more attractive, sort of format it nicely, put in more images. But then you also want to think about creating an executive summary in which you've got all these words, but okay, what's the bottom line? Where do you really want people to focus their work? What are the tangible nuggets that people are going to take away? And think about that very carefully. One of the big things for us was prevention work, trying to get ahead of mental illness, but really do preventative work. And then also, from whom do you want a support letter? So I really wanted a support letter from the president of our university. And so we asked, and we also suggested, we were really clear what were the highlights, or what are our priorities like prevention. And we were able to get one, and I think it really changed the tone of our ultimate strategy. It gave it more legitimacy, more high level attention, perhaps. So that was really important for us to do. So you've got your manual, you've got your strategy, and as many of you indicated, you're in the joyous part of implementation. So thank you.